Hello, welcome to the Geri Academy podcast with your host, geriatrician Dr. Golnosh Sharafsaleh, providing you with information on aging-related topics. Learn more at geriacademy.com and follow me on social media. Hello, welcome to the very first podcast episode of Geri Academy. I am your host, Dr. Golnosh Sharafsaleh, a geriatrician, and today I'm going to be talking to you with Dr. Cannon, who is a geriatric fellow, about what happens to us when we age. So, hey, Dr. Cannon.
Hello, Dr. Sharafsaleh.
So, I was talking to my husband the other day, and he said, so you're going to be a geriatric social influencer? And I kind of giggled, and I was like, I don't know about that, but 2020 has been kind of weird. We haven't been able to talk to our public about geriatric stuff like aging and dementia and the things that we normally talk to our public about. And that brought on Geri Academy so that we can write about it and hopefully share some of this with our older patients and their loved ones. And so starting with what happens when we age, right? I had this professor in college, and she was awesome. And she used to tell us every year you need to get in front of the mirror butt naked. And she used to say so that you adjust and adapt to the changes that happen. Not only that, she said you should be proud of these changes because these are the things that you've earned, right? Every scar and every crease and every wrinkle, they have just made you wiser and smarter and have given you more life to experience. So do you want to tell us a little bit about maybe some of the causes of aging, some things that end up happening, disease causes? I don't know, you start.
Well, as we age, it's not just one body part that ages, our whole body ages. We see differences in all different kinds of systems, and including the endocrine system. So the endocrine system is a system that is a collection of glands that produce hormones in our body that regulate pretty much all of our body functions. So as we age, we experience decreased testosterone, decreased growth hormone, insulin and thyroid hormone, and all the other essential hormones. Because of these changes, we're at higher risk of infection and diabetes, weight gain, and we might not feel the heat or feel the cold as we used to. And we even might not have a fever when we're sick. So especially when we're in the hospital and we see these elderly patients that come in without a fever, we still have to rule out infection because they just might not gain a fever. And then you also worry about fatigue and feeling down when you have decreased testosterone and estrogen. And that could lead to more weight gain. So the big thing to do as we age is make sure we stay active.
Right. So you're totally right about that. Sometimes we have patients that come into the hospital and they have a systemic infection, but they don't have any fever, right?
Right.
And then we end up finding the source of their infection and we have to treat it. So how about some causes of death due to chronic disease, right? Because as we age, we're more prone to chronic disease. Right. How about telling us a little bit about, which chronic diseases we really have to look out for?
So I can tell you about the top 5.
Okay.
So the number 1 is heart disease. We hear about heart disease all the time. Taking a baby aspirin to keep your heart healthy, making sure you're active, making sure you're eating right. So the heart disease is always the big number 1 right now. The number 2 is cancer. We have all different kinds of cancer. As we age, we might be more likely to get a certain type of cancer. And there's not just a certain type of cancer that makes it number 2. It's all encompassing. And then number 3 would be chronic respiratory disease like COPD, emphysema, chronic bronchitis, things that have happened over time. It's not just something that happens one day. So this is, again, chronic. Number 4 would be stroke. And again, with the heart disease, we can kind of help prevent some of these things with exercising, making sure your cholesterol is good, making sure you're eating the right medicine or you're eating the right foods and taking the right medicines. And then number 5, unfortunately, something that we see all the time is Alzheimer's disease. And, we're hoping that with some of these new medications that are hopefully on the forefront, that we might can move this down some. But for right now, Alzheimer's is number 5.
I think, since we have the memory clinic here, we do seem to deal with a lot of dementias. And maybe we can have a podcast and talk about different dementias too. I think that'd be
good too.
Yeah. So should we also talk about maybe the heart and the vessels around the heart and what happens as we age? I think sometimes our vessels are more elastic when we're younger, and maybe telling our audience what that means.
Right. And, we just talked about how heart disease is the number one killer of older adults and chronic diseases. So as we age, we start getting more and more plaque in our vessels. And it's not just everyone gets plaque in their vessels. Small children start forming plaque, but as we age, the plaque gets more and more cumbersome and we have more difficulties with it. So as we age, the muscles in the heart start to waste just like other muscles in our bodies do. And the vessels that are connected to the heart can start to build the plaque, and the inner walls might lose the elasticity that you're talking about. So it might be harder to pump the blood. So this could lead to heart failure, heart disease, increased blood pressure that we see as we age, some abnormal heart rhythms, and the decrease in the ability to exercise. So you might have some more shortness of breath and need to take a few more minutes if you're trying to exercise. And then another thing that can happen, we see a lot of dizziness in our older patients, and this is because sometimes it takes a little bit longer to get the blood back up to the heart and brain from when you're sitting or laying. So that's another thing we see as we age.
Okay. So can I think about maybe our vessels like plumbing, right? And then what we call plaque, sort of like the sewage that can get stuck in our vessels, right? And so we don't have the blood flow, or water can't flow through the sewage, right? Would that be a great analogy, right?
The grate might be too thick to get the water through.
Excellent. And so how about our lungs? Do our lungs change as we age?
Unfortunately, our lungs do change as well. So just like everything in our body, it becomes less elastic, so it's harder to take a deep breath, and the parts of the lungs that exchange the oxygen can start to decrease, and the demand for breathing muscle strength, so how our diaphragm moves up and down, it might make it more difficult to reach our oxygen demands. So if you have all this plus COPD, it's going to make it even harder to breathe.
One thing I've noticed also, when we have some older patients, and I guess in layman's terms, it's called hunchback, but we call it kyphosis. And those patients, as they get older and this condition gets worse, then they also have more difficulty breathing. In addition to lung disease, that tends to get worse just because they have less lung to have air exchange too, right? So then let's just kind of talk about the musculoskeletal system, since we were talking about this kyphosis situation.
So with the musculoskeletal system, just like we talked about in the heart, the muscle mass decreases, and then cartilage that is around our joints dries and deteriorates, and our body's ability to build bone slows down, mostly because we're losing this testosterone and estrogen that we talked about in the endocrine system. So our bones become brittle and weak. So we lose our muscle strength, our height. So as you notice, sometimes as we get older, we start hunching forward, we lose a little bit of our height, and then our posture changes, and we tend to stoop. So you could be at more risk for falling because your center of gravity is off. And then when our bones are more brittle, it could lead to osteoporosis, which is something that we try to prevent or treat if we run across it in any of our patients.
So I feel like we need to have a whole podcast on musculoskeletal stuff, and maybe even one on osteoporosis, right?
I feel that's coming down the pipeline.
Is it coming down the pipeline?
I think so.
Okay, awesome. So, all right. How about the liver and gallbladder? What happens there?
So as we age, again, everything kind of shrinks a little bit, so our liver will shrink, and it's more difficult to absorb and stabilize cholesterol, which leads to higher cholesterol, which goes back to the heart disease, and then sometimes it affects our ability to metabolize some certain drugs. So we have to look and see what drugs people are prescribed to see if it's appropriate given their age.
That's a good point, because sometimes people forget that older adults need different doses of medicine, right? Especially as these medicines are cleared by our liver and particularly our kidneys. Yeah, so can you tell us a little bit about the kidneys? What happens to them?
So as we age, our creatinine, our kidney function goes down a little bit, so we might not be able to metabolize some of the drugs that we used to be on, especially some of the blood thinners. We might want to avoid some aspirins and things like that because our kidneys might just not filter it well. It could lead to a buildup of this aspirin, could lead to increased bleeding. And then some of our drugs that we used to be on when we were younger might be toxic at the levels that we're on now because our kidneys might just not work as good.
Okay. So do you also, have you also seen that just reducing the dose of medications seems to help older patients reduce their risk of falling, right? Because some medications, as you increase the dose, because kidney function decreases as you age, these medicines, their levels can build up in the body, right? And so if you decrease the dose, then they may not have the same side effects, right?
And they might even feel better and want to go out and do more things, because something I learned in medical school is every single time we add a medication, we have a 10% chance of having a side effect or adverse effect. So a lot of our patients are on greater than 10 prescriptions. So that's a 100% chance they're having an adverse or side effect that could be affecting their daily lives.
Well, I just wrote a blog too that's on there on am I taking too much medicine?
Exactly.
So again, maybe we should have a podcast on what we call polypharmacy, taking a bunch of medicine, right?
I think so.
Okay. So tell me more about the stomach and the bowels. What happens there?
So as we age, we have decrease in gastric acid production. There's a decrease in calcium and iron absorption, which goes along with the osteoporosis and decreased muscle mass. And then we have more discomfort after eating because we have weakened muscle tone, so our stomachs aren't emptying as effectively. And then we have decreased number of taste buds, leading to decreased appetite. So you see all the time these older patients who don't want to eat as much. It might be because their taste buds just don't taste like they used to. And if they like certain foods, then that's the foods that they're going to want to eat.
Yeah, like sweet and salty. Those seem to be, some of the foods that individuals who are older and maybe have dementia that they're more interested in.
Oh, yes.
Right, rather than more bland foods.
Right. My grandmother, every time we went to the beach, she always had a big bowl of Three Musketeers. That was her favorite.
Awesome.
And that was my favorite part of Easter.
So just to sidetrack, I went home yesterday, after we had our COVID vaccines and no side effects, but went home yesterday and Jace, my husband, was like, "What are you doing with all this candy? Don't your coworkers know you? You don't eat that stuff." I said, "Well, I think they know me better than you know me." So, okay, back on track. So let's see. What else? Where are we? So the skin, what happens? I know you can definitely see the changes that happen with skin, but there's actually some medical things that we have to think about.
So as we age, our skin becomes thinner. So if you ever look at an elderly person's hand, it looks thinner. You can see the vessels more clearly. They're more prone to tearing or ripping. And then we've lost elasticity. So sometimes I even see this in my face already. I'm losing some elasticity around my eyes. And then we lose that protective fat layer and we lose some of our sweat glands, so we're not sweating as much. So again, when we talked about how we might not be able to feel the heat and the cold, we might overheat when we're elderly because we can't sweat as much.
Yeah.
So as we age, because we lose all these things, we might have more dry skin, more wrinkling. We might be more sensitive to the sun. And then because our skin is so thin, if we're in one position for too long, we might get pressure ulcers, which is something we have to combat in the hospital all the time. And then if you do have a skin tear or rip, it might take a little bit longer to heal because it is so thin.
Yes, so, and it doesn't have that blood supply, right? That great blood supply that like a baby's skin has.
I know.
So just kind of talking about the skin some more, when you have an older patient that it tends to have dry skin and they tend to get a rash because their skin is dry, what kind of advice are we giving these patients when they come to the office?
So don't take extremely hot showers. Make sure you're using good moisturizers like Aquaphor, Vaseline, things that you can still feel on your skin. That's going to help nourish your skin. And, try to keep your skin covered when you go outside so it doesn't get too cold. But really the big thing is avoiding the hot showers because that's going to make your skin dry out even more.
Okay, awesome. All right, so let's talk now about some of our sensory system, right? Like our senses when we talk about our sight, hearing, taste, touch, and smell. So what happens to our vision?
So our vision, lots of things happen. You hear about glaucoma, you hear about cataracts. We have increased risk of that. You hear about macular degeneration. Then we have we have difficulty seeing sometimes and sensitivity to glare when we're driving. And then you notice that we have difficulty with depth perception, which can lead to falls. So you're already stooped over a little bit and you're having trouble seeing how far something is away. Then there's difficulty differentiating between different colors like blues and greens and violets. And then like our skin gets dry, our eyes can get dry too.
Oh, gosh. Okay. So how about hearing? What happens with our hearing?
So as we age, we can have increased earwax, which, goodness, if that happens to my daughter when she ages, she's going to have the most earwax humanly possible. And then there's changes in the inner ear, which can affect our balance, and then loss of hair cells. So there are tiny hair cells in our inner ear that help us hear. And they pick up sound waves and change them into the signals that our brain can interpret and notice that we're hearing sounds. So as we age, these little hair cells get damaged and they don't regrow, so we might not hear certain frequencies. So hearing loss is a big thing with people who are isolated. It can make isolation worse. It can make you depressed, and you might not want to go out and do things because you have trouble hearing. And it might make things more difficult if you're at someone's home and there's a TV on and there's something in the background and they can't hear you very well. It might lead to more frustration to your family members or yourself. And you have to be able to listen to someone speak. So talking slower with a little bit more, emphasis in your words might help people with hearing loss as well.
And so when you were talking about frequency, can you tell us a little bit about the frequency? Because, sometimes we go in and talk to patients and we have to change the pitch of our voice so that our patients can hear us. And not only that, we have to educate family members, especially females, how they might change the pitch of their voice so their parent could maybe hear them better.
Right. So I have a pretty high voice, and it might be hard for someone to hear me. Now, I can always talk louder. I was a college cheerleader. I can yell anytime anyone needs me to, but I might have to deepen my voice so they can hear me clearer.
So would you hear me more clear like this, Dr. Cannon?
I would.
Oh, awesome. So what happens with our taste?
So with our taste, we decrease the number of taste buds, and sweet and salty, the taste buds change a little bit. So like you said, we might like the sweet and salty, so like chocolate covered pretzels and Three Musketeers like my grandmother liked. But our bitter and sour taste remains the same, so those might be a little bit more potent, so they might not like some of these bitter things that they used to like. So just know if your family member starts liking a little bit more sweet, a little bit more salty, it's okay. It's just how our tongue changes.
Okay. And then how about touch?
So as we age, we lose a little bit of our sensation. So we might have a decreased ability to recognize dangers like hot water, fire, or small objects. So that could lead to falling. That could lead to tearing the skin some more.
Okay. And then how about smell?
So luckily, smell doesn't really change as much with aging. It only decreases slightly. But if you notice that you have a complete loss of smell, that's not a consequence of aging. That might be something you need to go see your doctor about.
Oh, wow. Okay. So how about our brain? Let's finish up since we both love brain medicine so much. Yes.
Right.
So let's talk about kind of what normal signs of aging are and then we'll talk another time about dementia.
Right. So normally as we age, our brain does shrink. It does shrink some, and nerve fibers decline. And we talked about the hormones that might be decreased, so that helps control our mood and sleeping, eating, and digestion. So because our brain does shrink and as we age, we are at a higher risk of stroke, and we might experience age-related memory changes or possibly dementia. So we have an increased risk of developing depression when we're older. We're more sensitive to medications such as pain medications, or if you ever have to have a surgery, the anesthesia. And then we see a lot of the times as we age, we get a little bit more insomnia too. We're more likely to go to bed early and have trouble staying asleep and having trouble falling asleep.
So if I was an older person and I came to you and I said, I'm having trouble sleeping, and you asked me, well, tell me about your sleep pattern. And I said, well, Doc, I used to go to bed every night at 8 p.m. and I used to wake up at 5 a.m. and that was plenty of sleep. But now I find myself going to bed at 8 p.m. and waking up at 3 in the morning. What would you say to me?
So I would make sure that you have a good sleep regimen. So are you laying in bed with the TV on? That's terrible for your sleeping pattern. Are you taking medications that make you get up in the middle of the night to have to go use the bathroom? As we age, especially men, their prostates get larger, so they have to get up to use the bathroom more and more frequently. Us women remember getting up in the bathroom when we were pregnant multiple times a night, but making sure you have a good, quiet, comfortable place to sleep. And the big thing is, I suffer from insomnia. I take melatonin every night, and you want to take it about 4 to 6 hours before bed, and that's going to help you sleep some too.
So, why would you take it for about 4 hours, let's say, before you go to bed?
So our body naturally starts secreting it about 4 to 6 hours before bed because we're preparing ourselves to sleep. So it's just giving you a little extra boost of melatonin to help your body get prepared for sleep.
And so, how much does our body produce? About 1 milligram? Yeah, I think so. It's about 1 milligram equivalent. So we really don't want to take that much if that's what we need to take. And I think we should totally do a podcast on sleep too.
I think so too. Maybe we can get one of our sleep physicians to come talk to us about sleep and sleep apnea.
That would be awesome, don't you think?
Mm-hmm.
So many great ideas. Okay, so some of this kind of sounds a little discouraging, but I really don't think it is, right? Because as we know the natural changes that are going to occur as we age, we can be prepared and we can stay active and we can address them to prevent diseases. And so, I think we can age well, right? Gracefully. Exactly. Right.
I have one of my favorite quotes that I actually wrote in my fellowship application about aging gracefully. But let me see if I can find it.
Okay, so what's this quote?
So the quote is, "Old age is not a disease. It is strength and survivorship. It's triumph over all kinds of disappointments, trials, and illnesses."
And who said this quote?
Maggie Kuhn said this quote.
Interesting. Okay, awesome. So let's kind of talk about the fact that our healthy behaviors, right, they can slow the aging process and prevent chronic disease, right? And so the implications of chronic diseases are huge, and they can decrease the quality of our life, loss of independence, lead to death. And as we age, right, what is a geriatrician's biggest goal for their patient? It's to maintain their independence and the quality of life, right? And to live as long as they can with that independence.
And their quality of life.
Exactly. Awesome. So the risk of developing chronic disease increases with age, but the root cause of many diseases begins early in life. So at what age would you say it's really important for adults to maybe start making some changes if they have bad behaviors?
So I would say as early as possible, but we start screening people for diabetes starting at age 30, depending on if they're obese. So the earliest you can start, the better.
Right, because you have a lifelong goal of living well and independent, right?
Right.
So how do you think this went?
I think it went really well.
I think so too. And maybe we'll get some good feedback from our audience, right?
I think so too, and see what they want us to talk about. We think about osteoporosis and sleep, but maybe about medications and frailty, because that's something that could lead to morbidity and mortality, like early death. The earlier we frail.
So were you not going to write a blog about frailty pretty soon on Jerry
It's going to be coming soon.
Excellent. Okay, awesome. Okay, so what's this quote?
So the quote is, "Old age is not a disease. It is strength and survivorship. It's triumph over all kinds of disappointments, trials, and illnesses."
And who said this quote?
Maggie Kuhn said this quote.
Interesting. Okay, awesome. So let's kind of talk about the fact that our healthy behaviors, right, they can slow the aging process and prevent chronic disease, right? And so the implications of chronic diseases are huge, and they can decrease the quality of our life, loss of independence, lead to death. And as we age, right, what is a geriatrician's biggest goal for their patient? It's to maintain their independence and the quality of life, right? And to live as long as they can with that independence.
And their quality of life.
Exactly. Awesome. So the risk of developing chronic disease increases with age, but the root cause of many diseases begins early in life. So at what age would you say it's really important for adults to maybe start making some changes if they have bad behaviors?
So I would say as early as possible, but we start screening people for diabetes starting at age 30, depending on if they're obese. So the earliest you can start, the better.
Right, because you have a lifelong
Mm-hmm.
goal of living well and independent, right?
Right.
So how do you think this went?
I think it went really well.
I think so too. And maybe we'll get some good feedback from our audience,
I
right?
think so too, and see what they want us to talk about. You know, we
Yeah.
think about osteoporosis and sleep, but maybe about medications and frailty, because that's something that could lead to morbidity and mortality, like early death.
Yeah.
The earlier we frail.
So were you not going to write a blog about frailty pretty soon on Jerry
It's
Academy?
going to be coming soon.
Excellent. Okay, awesome. And so, well, I guess our friends and family who are listening in, this concludes our first podcast. Thank you so much for listening in. And please email me at jerryacademy@outlook.com or jerryacademy@gmail.com with any ideas on future podcasts. We'll try to do some more of these things, especially as this pandemic continues and we can't see you in person to talk to you.
But get your vaccine.
Get your vaccine. Neither one of us has grown heads or tails, right? I think
we're doing good.
We're doing really good. All right. Thank you.
Bye, everyone.
Bye. Thank you for listening to this episode of the Jerry Academy podcast. Learn more at jerryacademy.com or follow me on social media for information on future episodes.